Hello everyone, I am Dr. Jami Tejishwini, currently pursuing my senior residency in Department of Pediatrics SLN MCH, Odisha from India. My study is to assess the role of transcranial ultrasound in hospitalized high-risk newborns in a tertiary care hospital. The main objectives of our study is to find different transcranial ultrasound findings in a high-risk newborn and also correlate these findings clinically. Our study was a prospective observational study which was conducted in a tertiary care hospital for a period of 2 years. The sample size in our study was calculated by using the Fisher's formula. All the newborns who have fulfilled our inclusion criteria were enrolled in our study after taking a proper informed consent, following which they are categorized and data is collected in a preformed proforma and transcranial ultrasound was done. The findings were then correlated clinically. In our study, we have seen that about 60 newborns, that is 54.5% of the newborns, have abnormal cranial ultrasound findings. The various cranial ultrasound findings which we found in our study were like periventricular leukomalacia, intraventricular hemorrhage, cerebral edema, subgaleal hemorrhage, and cephalhematoma, etc. And in antenatal risk factors, the risk factors like pregnancy-induced hypertension and premature rupture of membranes is found to have significant statistical correlation with all these abnormal cranial ultrasound findings. In neonatal risk factors, the risk factors like birth asphyxia, birth trauma, hypoglycemia, and abnormal central nervous system examination of the newborn is found to have a significant statistical correlation with all the abnormal cranial ultrasound findings. The lab findings like hypoglycemia, hyponatremia, and positive C-reactive protein is also found to have a significant statistical correlation with the abnormal cranial ultrasound findings. As we all know, neonatal care in India is advancing at an impressive pace, both at a community level and as well as tertiary care level. And cranial ultrasound will be a ideal tool for the primary investigation in case of this high-risk newborn to assess the amount of brain damage. And our study highlights the convenience and diagnostic efficacy of cranial ultrasound in assessing the morphology as well as the amount of brain damage in these high-risk newborns. Thank you.